morning, everyone. I'm Megan Culp, along here with Scott Micklin.
Good morning, everyone. It is Monday, June 1st. We made it to June.
1st.
How about that?
Did we ever think
Right?
that you and I would be seeing each other 4 times a week?
It is the highlight of my day.
All the way until June 1st and beyond.
Yes. But here we are.
Here we are.
Right? But things are
Opening up
moving
slowly.
Right, forward and opening up slowly. We're going to talk about that today. June 1st is the first day of the new public health order in New Mexico issued by the governor, and even including San Juan County, which I think we should all give ourselves a pat on the back because we are caught up with the rest of the state. The numbers appear to be as well as the rest of the state to allow us to do that, which is great.
That's right. We've moved from preparation to phase 1 proper.
Yes. So that's wonderful. So congratulations. And we're going to be talking with Jamie Church later on in this very program about how we can support our small businesses, our businesses that had been closed, now reopening, and what they are doing to earn the trust of their customers, right? Because it's going to be part of that, too, to go back into businesses that have been closed for a few weeks. And not just a few, many weeks.
Many weeks.
Yeah.
11.
You're counting.
I am.
You really are.
I really am.
Yes. So that's
important.
where we are.
Somebody's got to be counting.
Someone does, and I'm glad it's you. So
Yeah.
to remind us where we are.
Thanks. Speaking of counting.
Yes. Numbers?
Yes.
You want to count numbers or look at numbers? Okay, we could do that. They're ready to go. Here we are, everybody. So, again, from the weekend, these numbers from Monday, the state has said are delayed yet again. Not every lab is reporting their numbers, and so that's why the numbers are a little bit lower than usual. But if we scroll down, this is ksje.com again. This is the at a glance that we put on there. And then as you scroll down, you can see the numbers here for New Mexico. Again, 69 new cases on Sunday, not a complete count. 5 additional deaths. That included 19 new cases in San Juan County on Sunday, and 2 additional deaths here, both elderly gentlemen, if I remember correctly, in their 80s. We can click on the story to see the details, but that was the statistics here. The Navajo Nation, again, had 98 cases, and now 79 additional deaths that were reported from the last time we gave those numbers, so they're now at 246. And so that is a big number, and again, it's a big jump.
Yes.
So I don't know if there was new criteria, and they've classified some deaths that weren't previously classified as COVID-related now as COVID-related, or what caused that big jump. We need to do a little bit more research into that.
Yeah. So
Montezuma County, 3 additional cases, no additional fatalities, and so we updated that story as well. So that's what that stands.
Okay.
So there's that.
There's the numbers.
There they are, everybody. Again, ksje.com. Look under our news category. There's the new public health order about dine-in restaurants, indoor malls, gyms, salons, and more reopening today at lower capacity. You know, that's the big criteria, that you can only open at maybe 50 or 25% of your occupancy rate.
Right.
So there you go.
Okay.
So there's that.
But wear a mask.
Right. Wear a mask. Don't touch your face. Wash your hands.
Right.
All that other stuff. And more testing going on again this week here in Farmington and Kirtland at San Juan College, I believe Tuesdays, Thursdays. We're going to be talking with folks from the health department this week on this very program. About the testing and what that means and why that's important to get a better handle on who's negative, who's positive, where there maybe hotspots are in the community, things along that line. So that's where we are.
That's where we are.
Yeah. So
it's good.
Exactly.
More testing equals more knowledge, which equals more opening up, I think.
Right.
It's part of the plan. Right?
I think that's true.
Yeah.
That's the idea. So so again, we are hopeful that all those things are in a good place. So we'll see what happens. You had a good weekend, right?
I did have a good weekend. I think you had
I had a good
slightly
weekend.
less good weekend, though.
It was okay.
Yeah?
I can't complain.
You got a little rock lobster going on, though.
A little red, yeah. A little out in the sun, a little bit.
Out in the sun, too,
Yeah.
without the sunscreen.
Yeah, that was
that time again.
That was bad. That was my bad.
You know what's interesting? I don't really know the difference between sunscreen, sunblock, and suntan.
Ah.
Do you?
Well, I believe...
Speaking of...
Obviously, no.
Yeah.
If you could see parts of my, but yeah. I think part of it is the protection that they give you to the ultraviolet rays of the sun, and so I think just tanning lotion doesn't probably provide any protection. It just makes your skin.
I think
get
back in the
brown.
day they used to wear like Crisco. or something
Well,
like
probably.
that. Yeah,
Yeah.
they were like
Yeah.
actively cooking
Just
themselves.
fry themselves on
Yeah.
the yeah.
I'm a huge sunscreen proponent.
Right.
Mm-hmm.
Well, and I usually am too. I'm not sure why. I think I just didn't.
You
Yeah.
weren't thinking.
Weren't thinking. And
Corona
now
brain.
I'm pink. Lobster-ish.
Yeah, and the tie really brings out
Doesn't
the
yeah,
pink.
right? Exactly. Yeah. You're
Yeah.
welcome.
Yeah, I went hiking. It was
Do not
super
adjust your
great.
sets, everybody. You went hiking?
Yes, super great.
Nice. Up in Colorado?
Yep.
Very good.
Yep, our neighbors to the north. Because
Excellent.
it was a little hot here.
Yeah, it was. That's true.
So, trekking up north
Good
for
for you.
that. Highly recommend.
Nice.
Yeah.
Did you physical distance from the other hikers?
Yeah, I did. Yeah, I mean, it's broad enough, and as the docs told us last week, it's better to be side by side than behind each other. Remember that? Do you remember
Yeah,
that?
I do remember that.
The swirling droplets.
Yes, thank you.
I know.
Thanks
I
for
saw
that
your
visual.
face. I
Yeah.
saw your face during that.
Yeah.
So,
Good.
Yeah.
So you were side by side.
right, but
Okay.
and broad.
6
side by
feet.
side.
apart.
Yeah.
Good.
In hindsight, I was close to the edge, the incline, which seems like a bad idea for me. I should have been hugging the tree on the other side. I'm just not known for my agility, shall we say.
Understood.
Understood.
Gotcha. Okay.
Gotcha.
Well, I was stuck on the tree hugging image of you.
Yeah, not like that's awesome.
Yeah.
That's so great. I'd be the last person I know to like actually engage in tree hugging proper.
Well, you don't need to physically distance yourself from trees, so
No.
go for it.
Hug
If you
'em.
need a hug,
If you need a
if they hug you back, call me, because that's a
If they
story.
hug you back,
That would be a great
that
story.
is a story.
It would be.
Oh my God, this tree just hugged me back.
Right.
I'm living in the giving tree.
Exactly.
Oh man.
Or Middle Earth or something's going on.
Yeah.
See? There
Nice
you go.
reference.
You're welcome. Yeah.
Nerd core.
Thank you. Thank you.
Yeah.
So we are expecting a call from Jeff Bourgeois
Yes.
from Samuel Regional Medical Center for the viewers and listeners wondering what are we talking about and why we are just rambling
Well,
on about
let's
hugging trees and weekend activities.
Well, be outside. That's the docs have said that. Get moving. It's
True.
summer. But also, let's circle back to the Navajo Nation.
Okay, let's circle
Shall
back.
we?
Why not?
So, why not? Well, so some national news affiliates have been covering these deaths as well, as we know.
Yes.
We hit the national news. And part of it is talking about sort of in the death toll, how many of those folks are the elders proper. And those are keepers of the tradition. So there's a lot of fear, not just in protecting the health and safety of the reservation as a whole, but also protecting cultural traditions, which I thought was fascinating.
Very important, right?
Super important.
Exactly.
So
and if those
it's a whole
folks-
other dynamic inside of it that maybe we haven't been thinking about.
True. Very true. Well, I think we can go to the phones
Great.
now. So
Cool.
we can do that. Good morning. You're on KSJE. Thanks for calling in.
Hey, Scott, good morning. This is Jeff Bourgeois.
Thank you, Jeff Bourgeois. Good morning. Jeff Bourgeois, of course, CEO, Salmon Regional Medical Center, joining us this morning. And so, Mr. Bourgeois, what's an update from the hospital this week?
Well, we continue to watch our COVID-19 caseload slowly decline over the last couple of weeks. And this morning we have a total of 24 positive patients in-house and another 13 that are PUIs, as we call them. So it's softened quite a bit from our peak, but still we are not completely out of the woods, nor is our community with this virus. But good progress, and we are mirroring the trend lines that we're seeing at the state level now, and so our rate of spread is now down below 1.1, and that's important. So 1.0 or less truly means that the disease is not spreading in the community. So that had been as high several weeks ago as 1.33. So much progress in slowing the rate of spread in our community.
And Mr. Bourgeois, that number that you quoted, that 1.1, is that the idea that one person is spreading it to 1.1 people? Is that the idea? And that's the
Yes.
lower the number, the better, right? We don't want to be spreading it to 3 people as we were before, perhaps.
Correct.
Got it. Thank you.
So
Exciting, we think, is going to happen today, Scott and Megan, I think I heard you there, is that we anticipate at some point today our 200th discharge of a COVID-19 patient since we began admitting COVID-19 diagnosis back in March. So we're going to have a little celebration and acknowledge that patient as they transfer to home, and exciting opportunity for our caregivers to see that level of success throughout a pretty challenging time.
Great. And there was an acronym I heard in there when you first started talking, the PUI. What does that mean?
Oh, I'm sorry. Yes, that's a patient under investigation.
Oh.
So that's where we're pending a test result or monitoring other clinical symptoms before we rule them in or out as a COVID-19 formal diagnosis.
And when it comes to the RI, the rate of infection coming down to 1.1, does that just mean that the total population now is less infected? That doesn't necessarily mean that the virus is less virulent, right?
Absolutely not. The virus is as virulent as it's always been. What it means is the rate of spread in our community is slowing down. Scott interpreted that correctly. You know that for every one person that gets it, one point, they'll spread it to another 1.1 persons. It's a statistical calculation that measures essentially the effective rate of spread in the community.
Very good.
We were actually down to 1.09 later in the week, but 1.1 was the official number for the Northwest region that was shared on from the Department of Health.
Okay, interesting. And so, again, because of these numbers, Jeff Bourgeois, this is the main reason why the governor, I would assume, included San Juan County this time in her latest public health order, and the reason why we are seeing some businesses able to reopen at lesser capacity, but still reopen today. The numbers support that decision, it seems like.
Exactly. And, that's important to note that you bring that up, Scott. We were in the pre-opening phase when the rest of the state was in phase one, and what the governor's order effective today does is essentially allows us to skip phase one, and we move to phase two with every other region in the state. So I know many of our local businesses have been hurting, and this was welcome news to be able to move directly into phase two. So we are excited for our local businesses and ready to get our local economy back up and running.
Right. Well, I know a lot of folks are excited too. We're going to be hearing from Jamie Church here in a little bit on this very program, Jeff Bourgeois. But I know you can be excited, but you also have to be cautious, right? Because we don't want to overwhelm our medical professionals at the hospital. And so we still need to be smart about how we do things as we start going back out, maybe to eat, start gathering with more folks perhaps, and doing some of the things we've missed doing for the past 11 weeks.
Exactly right. This is really a crucial juncture for our community, Scott and Megan. While we are able to begin reopening various businesses, as you mentioned, at certain different levels of capacity, et cetera, we have got to make sure we maintain all the types of precautions that we've talked about over the past weeks. Wear a mask, wash your hands often, practice social distancing. Large mass gatherings, if you will, are still prohibited, and we could find ourselves in trouble quickly if we do not just pay attention to these basic things. I know particularly the mask, might seem intrusive to many others, but I think everyone really needs to take the message to heart that we need to respect this disease, how easily it is transmitted, how sick certain people can get from it, and so not only protect yourselves individually by wearing a mask, but protect those around you. And just as a sign of respect, we ask that all these precautions be followed, and particularly for those businesses that have struggled for so long, respect them. And if we can continue to slow the rate of transmission, then we can open up more and more of our economy. But what I would be concerned about is if we ignore these things and have another spike, we're going to find ourselves in trouble again. So I can't stress the importance enough of wearing a mask, washing your hands, and practicing social distancing. This is not a time to get complacent with all the safety precautions that we're aware of.
Great. And speaking about community spread, are you guys still doing your external testing sites?
Great question. Actually, only today for those that call and get an appointment through our screening line. And the Department of Health now has stepped up and is doing actually 4 days of testing this week. Today, from beginning at 7 on a first-come, first-served basis out at Kirtland Judy Nelson School, tomorrow at San Juan College. All these times, by the way, begin at 7. They're on a first-come, first-served basis. As long as they have testing kits available, all they ask is that you bring your cell phone for registration. There's no appointment needed. The test is available to everyone at no cost. So today at Kirtland Judy Nelson, tomorrow at San Juan College, Wednesday the 3rd back at Kirtland Judy Nelson School, and then back to San Juan College on Thursday, June 4th. We shared this on our weekly update this past Friday. It's up on our Facebook and social media sites, and we encourage you to contact the Department of Health. The local number for the Department of Public Health Office is 327-4461.
Very good. And Mr. Bourgeois, I know that the hospital still has its kind of information line staffed even during this time, right? Correct? You still have some health professionals to answer questions about COVID-19, and that continues. Yep,
that's right. Thank you, Scott. Phone number for that is our screening line, COVID-19 screening line at 675-4722. And that's available 8:30 to 4:30 Monday through Friday. The state also has an 800 number at 800-600-3453. Both of those are screening lines. So if you feel you have signs or symptoms and want to call and get further direction about what you should do about that, those are the numbers to call. And then as a reminder, if you feel you have signs and symptoms and feel you need to come to our emergency department, please, by all means, do so. Do not hesitate to come. But we ask that before you come, call 609-2901. And all these numbers are on our website and on our social media platforms. But that number is to make us aware you're on the way with concerns about possible COVID exposure. And then we can make sure we protect you, our staff, and everyone else that you might come in contact with.
Very good information, Jeff Bourgeois. Thank you. And again, as we just wrap up our conversation this morning, again, we appreciate your time speaking with us. Looking to the future now, again, things are opening up a little bit today. We hope that the rest of our state will continue to move forward. The numbers will still be under control. We don't overwhelm any of our healthcare facilities, but it seems like this is going to be with us for a while, and so doing some of these things that we're now doing is going to be with us for a while. Would you agree? I mean, even when we talk about vaccines and things like that, there still is kind of that unknown, and for the next foreseeable future, this is going to be how we are.
I would agree, Scott. A vaccine is being fast-tracked, but it will be many, many months before it's available, and no one right now actually has the crystal ball to say when for certain a vaccine will be available. So this virus is in our community, and it has been widespread here, as we all know. So in order to just maintain the control of it at a low rate, all these things that we've talked about time and time again, and particularly if you're a vulnerable person, either of advanced age or have underlying health conditions, stay at home when possible. If you need help with chores and grocery shopping, try to find someone to help you with that so you can just really minimize your risk of accidental exposure. And then for all of us, I just strongly urge everybody, until we can get past this, wear a mask and wash your hands, please. It is. It sounds easy. I know it's an inconvenience, but those are two of the most proven effective ways to prevent the spread of the virus. And again, it's not just about protecting you; it's about yourself. It's protecting those around you as well.
Very true, and you're right. It is fairly easy to do, and it has shown that it can really protect a lot of folks and keep this thing from spreading any quicker than it already is. So appreciate that, Jeff Bourgeois. Thank you for joining us again.
Scott and Megan, thank you so much for allowing us this opportunity to visit with your audience. We appreciate it.
You bet. Thank you so much. That is Jeff Bourgeois, the President and CEO of Salmon Regional Medical Center, with us here on KSJE, and we always appreciate the information.
We do. I
Yeah.
love it.
Yeah.
Big fan.
Good information. So there
Good
you go.
information.
Very good. And we have another person on the phone.
I wonder if it's Jamie Church.
It could be. Good.
Yes, it is.
There she is.
All
I'm going to have to
right.
introduce
Good
her. She's
morning.
ready to go on cue. Good morning, Jamie Church from the Farmington Chamber of Commerce.
Good morning.
Thank you for joining us this morning. This is, I would think, an exciting day for you and the members of the Farmington Chamber, as businesses that have been closed for 11 weeks are beginning to reopen and are able to reopen. So talk to me a little bit about that. I know you've been really
Yes.
waiting for this moment.
Yes, so I think it is a very exciting day, and it even though it's a gradual reopening, it just means moving forward economically. Also, it means that with the virus, the numbers have kind of gotten to where the Department of Health wants to see them, and so maybe we're also, on the downward trend of that. So it is very exciting. These businesses have been dealing with a lot over the last 11 weeks, uncertainty and, having to lay off employees and just not knowing what the future was going to hold. So it is exciting to be getting back to business.
Very good. And so you have been putting out, I know, information to your members and others, because it's on your Facebook page, I think, too, about tips on how to do this safely and responsibly and following the governor's public health orders and things along that line. And that's one
Right.
step. And then the other part is going to be, right, to get the confidence of these customers, right, to make them feel safe
Right.
as they come back into the stores, right?
Right, and that's exactly, and the two are very much hand in hand. So for the safety of employees and staff as they come back, making sure that you have all of the safety equipment that you need, masks, and maybe setting up hand sanitizing stations and going through like cleaning procedures with your employees, and really stressing that if they don't feel well, if they feel ill, that they need to stay home. So really those conversations between employers and their employees. And then again, that's going to help the customers and the consumers feel safe when they go into these places of business. And when our consumers and our public feel safe going in and shopping and doing things like that again, they're going to be telling their friends and saying, hey, I went into this place and it was, they really were following everything. And so I felt really good about that. So I think it's a hand in hand, and it's going to take some time. I know, this is not going to be it's Monday, June 1st, everything's just like it was 11 weeks ago. There's going to be a ramp up as the businesses learn kind of how to navigate this new environment, and then as consumers and the public, that they feel confident. So it's going to be a ramp up. For example, the Chamber of Commerce, basically our building has been closed. We've all been working from home, and we're going back and reopening today, but on very modified schedule of 10 to 2. And then as things progress and move forward, we will extend our hours, bring back in our networking events and things like that. But it's going to be gradual. So.
Very wise. So when you mention
Thank you.
shortened hours, is that for the sake of more sanitizing after you guys leave, or is that just, again, for the sake of just limiting how many people come into
Yeah.
contact?
Exactly. It's limiting. I mean, the governor is still encouraging people to work from home as much as possible. And over the last 11 weeks, we've actually gotten pretty good at working from home. And right now, we're not doing any committee meetings. We're not doing any networking events. And we don't really have, we're still kind of trying to keep the building a little less public access just for the COVID safe practices and things like that. So it's mostly that. It's just we feel like, we don't need to be there from 8 to 5 right now. And if we can still have our employees working from home the majority of the time. But, if we have a brand new member, for example, we got a new member last week, and I just set up an appointment with him personally to meet there during, the hours that I was going to be there. So we're just trying to kind of gradually get back to the way things were. But again, I don't see us doing any large networking events or anything till at least July, where they're in-person events, and maybe longer.
Sure.
We're still waiting on the directives on that as far as mass gatherings go.
Right. Well, that makes sense. But Jamie Church, I have it on good authority that you are planning an online mass gathering actually this week that I wanted to ask you a little bit about. And you've got a pretty big name associated with this.
Yes. So
how exciting is that?
Together, I know. This just kind of came together last week. And so Neil McCoy, it's just so cool. We wanted to do a virtual business after hours to celebrate businesses getting to reopen and also to thank our chamber members and our small business community for kind of sticking with us and sticking with Farmington and our community. So Neil McCoy is going to be doing a Facebook Live concert, and that'll be this Thursday, June 4th. I better say it right because I posted it wrong earlier on my personal page. June 4th at 6 p.m. It'll be a Facebook Live event. People can just tune in, Facebook Live. They can even comment in with questions for Neil if they have them. But just enjoy a free, I think it's going to be about 45-minute concert, Facebook Live. There's no cost. We really want to do this as a thank you. And Sheila Mobley was kind of the person who, kind of was the spearhead on this and said, hey, I think this would be a great idea. And I was like, yep, I like it. So we got some sponsors. So that is great. Citizens Bank and Four Corners Community Bank. I really liked this. It's the two community banks really working together and coming together to sponsor this, which I thought was super cool. And Details Boutique and M&R Trucking and then Moti Drilling. And they all kind of came together and threw in some sponsorship money at the very last minute. And so we get to have this free concert on Thursday with Neil McCoy.
How exciting is that?
That is exciting.
Right? And I guess in true business after hours fashion, you could join with an adult beverage if you prefer.
That's exactly. So everybody will be at their own home, and they can schedule their own watch party while they social distance from their own home, and they can have their own little drink of whatever their drink of choice is, and they can be at home or out on their back deck or, and watch and just kind of, again, it's a celebration, but it's also a big thank you. This has been a trying 11 weeks, and we've been trying to share information, and there's been a lot of information out there. It's just so, I just think it's time for that kind of that great little sit back and have a fun, enjoyable evening. And we can't do real business after hours right now, and I don't know when we will. So if we can continue to keep people connected and feeling like they're part of something, part of the community in some way, and especially in the business community right now, as they start reaching out to their customers and saying we're open, whatever we can do to help with that at the chamber, that's why we're here.
Right. Very good. And so again, the date again for the virtual business after hours is this Thursday at 6 p.m.
Yes, this Thursday, June 4th, 6 p.m., Facebook Live. And we're going to be putting a lot of information and creating an event through our chamber page. And, of course, I'll be sharing it on my personal page, and Sheila Mobley will be. So we'll be getting a lot of information out because we know this is like, we're not having a lot of build-up to this. It just kind of all came together in the last few days. So but we'll be putting it out there and just encourage people, sit at your house on your back deck and listen to this free concert, and I think it's going to be pretty cool. So
excellent. Well, we're looking forward to it, Jamie Church. Yeah. That's going to be a lot of fun. And so we had a question, I think. Megan, you had a question?
Yeah. Let me just slip on in here.
Please slip on in.
Yeah, well,
Yes, for
like,
Jamie.
so what kind of, have you been able to patronize these businesses opening at 25% capacity? What's that looking like? I'm a huge fan of some of the things that the fast food restaurants have been doing where, like, humans are behind sneeze guards now.
Right.
I think
Right.
we should have always been behind sneeze guards, actually, but what kind of other stuff?
That's one
Well, I
thing,
know
right?
that- well, and I know a lot of it is, for example, in the salons where they're going to be just having an appointment, which is kind of what they always did. But I mean, they're going to be scheduling appointments with their clients and then staggering that so that they only have 1 to 2 people in their salon, depending on their capacity. I've encouraged some of our chamber members that have been calling me about opening to set up a hand sanitizing station if they can get a hold of hand sanitizer just at the entrance there, encourage people to use it. Having masks on hand so that you can get, packages of the disposable masks at different places around town, having those there so that if a customer does come and you're requiring everyone to wear a mask, that they don't have to leave if they don't have one, and that you can say, oh, you know what, we've got masks here for you and they're disposable, so here's one, feel free to take it with you. If they have customers that don't want to wear a mask or cannot wear a mask for some reason, then offer to do curbside or see how else you can, do the transaction or whatever it is. So I haven't had a chance yet to patronize, as you mentioned, but things have just started today, and so I've already had a few phone calls, though, from people asking, well, what do I need to do? And I heard we can reopen, and so I think just really engaging in that social distancing still with keeping, having your floors clearly marked if possible about what 6 feet is, and just letting your customers know that you're taking this seriously. It'll be interesting to see with some of the stores in the mall, the Hobby Lobby, the TJ Maxx. It'll be interesting to see what they have in place. But again, I haven't had an opportunity to go visit any of those places yet.
Right, understood. And I think for us in the public and as customers, right, we all can be a little more patient, perhaps, as you mentioned, Jamie Church, as these businesses reopen. And again, they are limited as to how many folks they can allow inside their stores at a given time. So we may have to wait outside for a few minutes before we get in, and those types of things, right?
Yeah, and I think we're all kind of used to that already. I mean, I think most of us have had to wait in line at one place or another to go in. So this is already something, this is not brand new to us. We know that we have to keep the distance. We know that sometimes we might have to wait in line. We know that stores are requiring masks. I mean, when I go out now, I always check my purse. Oh, do I have my masks in here? Because if I know these rules are in place. So I take some responsibility on myself to understand what I need to do. So I think we've seen this. This is not brand new today. There's just going to be, as these smaller retailers and smaller businesses now join what the larger stores have been doing now for a couple of months, it's just going to take them a little time to get all their systems worked out. And so, yes, flexibility, patience, understanding, that's the key here. This is all new for all of us. And so we do need to be a little kind and patient with each other right now.
That's true. I tell it to Megan after every show.
Yeah.
So there you go. Jamie, thank you so much for joining us this morning.
Easy target over here.
Well, and I'm assuming you guys will be tuning in to the concert on Thursday.
Yes.
So
Totally.
So have some questions ready because Neil's willing to answer them live on Facebook.
Oh,
So
well, we
if you
love
have
asking questions over here.
Megan loves
Yes.
asking questions, so.
Just asking questions. I mean, I just think it's a cool thing. So thank you guys for having me on this morning.
You're very welcome. Thanks for calling in, and it's always great to talk to you. So thanks so much.
Okay, talk to you soon.
Take care. That's Jamie Church, everyone, from the Farmington Chamber of Commerce. And again, we're talking about the Farmington Chamber, but again, local businesses are reopening in every community in New Mexico today. And so again, no matter where you are within the sound of our voices, you can patronize Aztec, Bloomfield, Kirtland, Farmington, doesn't matter.
Sort of, except for, isn't Arizona on lockdown? Can they hear us?
They can
can't
hear-
us.
they can
well,
maybe-
KSJE.com, you can stream
Anybody
anywhere
can
in the
hear us.
world.
That's true. But there you go.
New Mexico region.
So please follow your local ordinances.
Well, yeah, and Durango can certainly hear us. And
Yeah.
they've been open for...
They have been open for a little while, but
Yeah.
still they are the same type of thing, right? They're not fully
That's right.
capacity, so same types of things.
Yeah, and
But
they have to wear a mask just like us.
that's right.
Yeah.
So we're excited again for our local businesses, and excited to kind of get back to maybe doing some more supporting of local businesses.
That's right.
So that's been great. So anyway, we wanted to maybe address one question that came in during
Yes.
Jeff Bourgeois' interview earlier.
Yeah,
that
sorry we missed that.
we did miss that, but that's okay. But
We didn't have the function turned on.
we did not.
Couldn't see it on the screen.
But they were asking about recoveries,
Yes.
right? So
Right.
as we talk about that, we do have that as part of our dashboard here on ksje.com, right on recoveries. So the question was specifically, Megan, do you remember?
Yeah.
You wrote it down.
I do.
Thank you.
What do recovery numbers indicate? Is that they haven't, because and this person said they have not been cured, they're just showing no symptoms, which is why I think it's more of a doc question. But we do have the
Right.
number of recoveries.
We do report the number of recoveries from the state health department every day. They put those again with the number of cases, and so as you can see, there was 125 additional recoveries reported on Sunday. Now at 2,853. And so again, I think too, with Mr. Bourgeois saying they're going to celebrate their 200th discharge from the hospital of patients that have recovered from COVID-19, or at least able enough to go recover more at home. I guess the idea would be that they are no longer maybe symptomatic, and they have recovered enough to be able to go home and maybe then get back into
Right,
their
after
normal,
the 14-day period.
right,
Yeah.
their normal life, and that's the idea.
Right.
And we know that there are antibody tests that are out to
Yeah.
even tell you if you may have been infected
right.
and not even had been sick.
Yes, I personally know somebody who's been able to get the antibody test, and I
Okay.
believe we're going to try to.
We're
We're
working
investigating
on
that
talking.
more.
There's
Yeah.
a resource here locally now, so we're going to try to track that down and maybe
Mm-hmm.
get them on the show later in the week. So stay tuned for that, everybody. But yeah, so this virus is just so different.
It is, yes, because this person that they tested positive for antibodies, but they never were symptomatic.
Never got sick.
Right.
Right. Interesting. Okay.
Mm-hmm.
Well, there you go. Well, I think we are about done with the show today.
Yeah.
Great
We
show.
already covered the tree hugging and the
We
sun
covered the tree
block,
hugging,
so-
sunblock, all those different things.
Oh,
Exactly.
yeah, and local businesses and hospital censuses.
And the important stuff.
Right.
Exactly. On tomorrow's show, we should mention we are going to get a return visit from the one and only Tom Yost.
Yost with the most. I feel like we.
Okay.
that's what
what you call him.
Well, I call him Tommy Tom Toms actually, but I also call
Okay.
him Yost with the most.
All right.
Well, I don't think we
Sure,
should
he
ruin.
appreciates that.
I think so.
Okay.
He just calls me Rev. I mean, it's a thing, and then we swap Fish Lyrics, the
Right.
jam band.
Right.
Anyway, I don't feel like we should ruin the surprise, but he's gonna have. He always has some cool stuff
Okay.
on his videos. So.
Yes. Well, he's been doing some golfing videos. If you remember the first appearance on the show, he was
Right.
actually live.
He was,
in
and he
his
had like his polo and his
living
golf
room.
shorts
Yeah.
in his living room.
And his little footies, or like socks.
Socks.
Yeah.
Socks is what you're looking for,
Yeah.
not footies.
Well, whatever.
It's
Well,
like-
they didn't look like normal socks to me. They just looked like, I don't know, golf socks, if there's such a thing.
I think there's golf everything. Golf
Yeah.
insert here.
So,
yeah.
anyway.
But yeah,
So you may be joining us tomorrow. We don't know if it's
Right.
inside or outside.
Tom Yost of the First Tee.
First Tee
Yes,
program.
the First Tee program,
Yes.
which is now as golf courses are opening up and the days are getting warmer and longer. They are reinvigorating their programming for kids, and it's a great positive program. And it's a lot of this stuff is no cost, and so teaching life skills through the game of golf, I believe, is their slogan. So it'll be fun to have Tom on.
It will be. And we love the First Tee program.
Mm-hmm.
It's well documented, does great things. So looking forward
Very
to that.
well organized. It's great.
Yeah. So that's
awesome.
tomorrow, everybody.
So are we going to catch this last question? Was this?
I see it. Yeah.
So the question is, listeners.
Yes.
My understanding of the data is that patients are considered recovered after they no longer show symptoms of the virus for the time period CDC has stated. I believe that is a minimum of 3 days.
Yeah.
There you
So
go.
we will check with the doctors on that too, when we hopefully
For sure.
are planning to talk to them again on the show for Thursday. So stay tuned. Everyone will try to get you answers to these questions because they are important questions. So
Yes.
appreciate them. So thank you for adding to the conversation this morning, everybody who's out there watching us. And we will be back tomorrow.
See you tomorrow.
At 9 a.m. right here on KSJE. Stay safe and stay well, everyone.